I'm Dr. Banira Karki. I'm a breast oncosurgeon, and I'm currently practicing in B&B Hospital and Norvik Hospital. Breast cancer, it's basically whenever there is the abnormal cells, they grow uncontrollably in the breast. They basically form a cluster, and then they take the form of a tumor, which is basically present in the breast tissue or in the lining of the ducts or in the lobules. So this is what is called a breast cancer. Breast cancer, it is most common in females, but yes, it can also be seen in males. It is basically associated with patients who have high risk factors, like patients with very strong family history, having genetic mutations, or have undergone multiple biopsies in the breast, or have taken radiations in the past, or also under hormonal therapy. So these are the patients who are most likely to get breast cancer. Symptoms of breast cancer, it's basically it presents as a lump or a nodule in the breast, and it may also involve the skin. So patients sometimes present with red discoloration of the skin, or the scaly scales over the skin, or there may be some nipple discharge, maybe blood or serous discharge from the nipple. Also sometimes patient may present with a nodule around the armpit or also over the collarbones. So these are the common symptoms of breast cancer. Well, there are certain factors which are modifiable, which can reduce the risk of breast cancer. So these are basically change in lifestyle, like you have to quit smoking and limit the alcohol, or quit alcohol, and also get into the habit of healthy diet, especially high fiber diet, vegetables and green vegetables and fruits, and decrease the consumption of processed meat, red meat. And I think these could help reduce breast cancer to some extent. Well, screening is basically a vague criteria. There is a vague criteria for screening in breast cancer. What I would recommend is every person should get a formal risk assessment by the age of 25 years. And then just know your risk, whether you fall into an average risk category or a high risk category. So following that, we advise breast cancer screening. Otherwise, generally, it's after the age of 40 years, you should start screening for breast cancer. Any symptoms of breast cancer, then it's advisable to see a breast surgeon. For breast cancer, when a patient is diagnosed with breast cancer, there are 4 options. In fact, not options, there are 4 modalities, I would say. First thing is the surgery. Another is the chemotherapy, in which we give injections to our veins. And third is the radiotherapy. And fourth is the hormonal therapy, in which we give medications. This is all based on the stage of the disease and also on the type of the tumor. So every patient, every individual have different type of cancer, so the treatment modalities will be different in all. There are 3 criteria to diagnose a breast cancer. First thing is the clinical examination, in which we find whether there is a lump or a discharge or the clinical high suspicion of breast cancer. Second thing is the radiological, in which we advise the patient to get an ultrasound, mammography, MRI as per need. And third thing is confirmation of your provisional diagnosis by the pathologist, that is through the FNAC, or most reliable is the biopsy. The early signs of breast cancer is the lump in the breast, or discharge from the nipple, or any change in the color of the skin, dimpling of the skin, or retraction of the nipple. Yes, definitely, we can do a breast self-examination. That is, we generally recommend to do a breast self-examination by the age of once a female is 20 years old. And we can do it every monthly while lying down or or while you're in the shower. So mostly in premenopausal lady, when she has menses at around 7 to 10 days, and she has to palpate the entire breast, both the breast from outer moving towards the inner side, followed by the examination of the armpit and also the area around the collarbone. So this completes the breast self-examination. Thank you.